Hello and welcome to this video tutorial on how to use the Quality Measures tool in OneChart. This training will focus specifically on the VTE quality measure. However, the tools and the system work the same for all of the quality measures such as heart failure, stroke, and pneumonia. Why do we need to ensure that quality measures are completed? Quality measures is an evidence-based standard of care which has been shown to result in improved patient outcomes. Most importantly, we need to make sure that quality measures are completed in order to keep our patients safe. For the VTE measure, it is especially important to do everything we can to prevent our patients from obtaining VTEs related to their hospital stay. Quality measure component in OneChart is a tracking tool that indicates when the quality measures are met or not met based on CMS specifications. It is recommended to be reviewed at shift handoff, daily rounding, and prior to discharge. The components will complete by pulling normal workflow documentation within the patient's record. However, there is functionality within the components to use hyperlinks that will link to the appropriate area to complete the measure. You might wonder, how do the quality measures get placed and when to order them? Quality measures get placed for a patient by having an order entered for the measure. At Christi, the VTE quality measure order is automatically placed by the system on all inpatient and observation patients. However, quality measure orders can be placed manually at any time. Quality measures do not require a physician's signature when placed by nursing. More than one of the same quality measure is ordered for a patient. The multiple orders will show on the Orders tab. However, only one component will display in the patient summary. Multiple orders can be voided to clean up the order screen. Let's look at the quality measure component once the order is placed. For nursing, the quality measure component can be found on the patient summary in the Assessment tab. The location of the component on this tab may differ for individual users, depending on any customizations made. Physicians also have the quality measure component on their home summary page. The component for each measure is divided into incomplete sections at the top and complete sections at the bottom. The numbers indicate how many items are complete and incomplete. If a measure is timed, there will be an alarm clock icon indicating that it is a timed measure. This means that there is a certain amount of time in which the measure must be completed in order to satisfy or complete the measure. Hovering on the measure allows you to see the time requirement. It also allows you to see the definition of the measure. You can select the filter by the drop-down to view all of the ordered quality measures or select only one to view. In the incomplete section, you can see blue hyperlinks. Selecting these links will take you to the appropriate ordering or documentation screen in order to complete that measure. Some of the links may be grayed out. This means that the order or documentation for this measure has already been completed or is not required. Even though there are hyperlinks to enable users to complete the measures, it is not required to do the documentation from here. The measure should pull the information and complete it when done as part of your normal workflow. When appropriate documentation or orders are completed, the measures will show in the completed section of the component. Keep in mind that the system will only look for documentation that is done in discrete fields, not free text documentation. Some measures may start out in the complete section and will only show in the incomplete section when specific conditions are met. For VTE, only one measure will start out as incomplete. The other three will go to incomplete if specific orders are placed or conditions apply. Now we'll talk about the requirements for the VTE quality measure. There are 4 requirements for the VTE quality measure. We will look at each one of these as it appears on the quality measure component and discuss the functionality of each. The first measure is VTE prophylaxis day of or day after admit. This is required for all patients admitted age 18 and over. This is a timed measure as indicated by the alarm clock. Either pharmacological or mechanical prophylaxis must be ordered and documented by the end of the second day of admission, or the physician must document a contraindication for both mechanical and pharmacological to complete the measure. Mechanical prophylaxis includes SCDs, anti-embolism stockings, or foot pumps. It is very important to ensure that the initial documentation for this gets completed as soon as possible after the order is placed. This documentation shows that you have followed through with the order. You will receive a task for this in Care Compass on the PRN tab that will open to the correct area to document. This can also be documented without the task in Flowsheet Doc in the Quick View band in the ADL section. If an antiembolism device is the only prophylaxis ordered and the patient refuses them, the physician should be notified to obtain an order for pharmacological prophylaxis. If no prophylaxis is ordered, a contraindication for both pharmacological and mechanical must be documented by the physician. If Xarelto is ordered as prophylaxis, the measure will not be completed until a physician documents a reason why. This can be done via the hyperlink on the component via the Reason for Oral Factor 10A inhibitor. As we can see on this patient, prophylaxis was ordered and administered. However, the measure is still incomplete. This is because Xarelto is the prophylaxis that was ordered. Once the physician documents a reason for ordering Xarelto, the measure will show as complete. The next measure is VTE diagnostics. Once a diagnostic test is ordered, documentation of VTE confirmed or no VTE can be completed via the hyperlink. The hyperlink will open to a power form where this can be documented. The status for this order will be complete unless a qualifying diagnostic order is placed. VTE overlap therapy. This measure is for patients with a confirmed VTE who have been on IV or sub-Q anticoagulation and then placed on warfarin. It is required that those patients remain on IV or sub-Q anticoagulation along with the warfarin for at least 5 days and until the INR is 2 or more for at least 24 hours. If there is a confirmed VTE and there is a contraindication for overlap therapy or a contraindication for continuing parenteral therapy, physicians or pharmacists can document this from the links on the component to complete the measure. The next measure is VTE warfarin discharge instructions. Patients who have a confirmed VTE and are discharged on warfarin must have written discharge instructions that include education on compliance, adverse reactions, follow-up monitoring, and dietary advice. This education is generally completed by pharmacy but can be completed by nursing to satisfy the measure. The links on the component can be used to document this, or it can be documented from the adult education band in the quality measures section. For measures that can only be completed by physicians or pharmacists, if a hyperlink is selected by nursing, a message will show to say that the documentation is required by a physician or pharmacist. VT orders placed by nursing should be routed to a physician for co-signature. Keep in mind that most of the quality measures will be completed from both nursing and physician ordering and documentation of normal workflow processes. However, it is everyone's responsibility to review the quality measures to make sure they are completed as appropriate. If you see that something needs to be done to complete the measure, either do the documentation to complete it, if able, or notify the physician it is something that needs to be done by them. This concludes the video on quality measures training. Thank you.